Hello, everyone. Welcome to our first ever Sepsis Alliance CareHolders Meeting. My name is Savannah Stark, and I'm the Vice President of Development and Operations. We are thrilled to have, it looks like, just about 100 of you so far joining us today, with more coming in. You can see our agenda here, and before we start, I'm going to go over a few housekeeping topics. While I'm doing that, I'm going to launch a quick poll to give us an idea of who's in the audience today. You'll see that on your screen now. Please take a minute to answer those 2 questions. Your audio is automatically muted. If you have any questions for the presenters during the webinar, please type them into the Q&A box on your webinar dashboard. We'll try to get through as many questions as possible at the end of the webinar. We have Alex Colvin, our Director of Marketing and Communications, and Matthew Prohl, our Director of Corporate Development, here to help answer questions as well. The webinar is being recorded and will be available by request in the coming days. Wonderful. Thank you again, everyone, for joining. Okay, so before we go through the presentation slides, we actually want to start with a short video about Sepsis Alliance.
My name is Carl Flatley, and I founded the Sepsis Alliance in 2007 after the unnecessary death of my daughter Erin, who died from sepsis. In 2002, my daughter came home from college. She was going to graduate school and went in for a simple outpatient surgery. She had that done on Wednesday. Sunday night, we took her back to the hospital, and on Tuesday, she was dead from something I'd never heard of. I was with Erin when she died, and she looked at me and her eyes said, "Can't you do something, Dad?" I mean, she was scared. And she was gone just like that. Sepsis is an overreaction of the body to infection, and it can cause death or disabilities.
When Carl lost Erin, he looked around for an organization to help put his resources into. He found there was no organization at that time that was doing any work around sepsis advocacy. So Carl Flatley did what Carl Flatley does. He said, well, heck, I'm going to have to do it myself.
There became a determination that I saw in Carl's eyes that I've never seen before, to find out answers to questions that we didn't know, and to make sure that no other parent experienced the loss of a child from sepsis as he had had to endure.
Sepsis kills more people than breast cancer, prostate cancer, and AIDS put together.
12 children every day die of sepsis, and that's more than cancer. So we have a huge awareness challenge in front of us to get that word out.
The goal of Sepsis Alliance is public awareness, because if a patient does not recognize the early symptoms, then a lot of times not get to the hospital on time to get the appropriate treatment.
When I joined Sepsis Alliance in 2007, fewer than 20% of the U.S. population had heard of sepsis before. We still have a lot of work to do, but before Carl got started, 19%, and now we're at more than 50%.
Without Carl, we wouldn't have protocols to manage sepsis in almost every hospital in the country. Without Carl, children would be dying more frequently than they are today. He single-handedly has changed the way we think about sepsis in America.
The success of Sepsis Alliance to spread awareness and save the lives of others would verify what Erin said. Can't you do something, Dad? This would in fact verify that I did something. She'd really be happy.
Good morning. I'm Carl Flatley. I'm the founder of Sepsis Alliance. I'd like to welcome you to this inaugural event, the CareHolders Meeting. We want to kind of give you a history of how this whole thing started. I'm pretty proud of this organization. It's quite unique and remarkable as to what's happened. In my opinion, we have and we are changing the way infections are treated. And this isn't hyperbole, in the world. Infections have killed more people than all the bombs and bullets of war. And infections are what most of us are going to die of. The good thing is infections are preventable. And if infections are preventable, sepsis is preventable. The video you just watched was produced by the NASCAR Foundation in 2015. I was nominated for this award, and I was on the finalist panel for sepsis. Well, it was the humanitarian of the year. I was pretty impressed for my sepsis work, and it was it was it was a terrible price I had to pay to get to that point. To tell you, I didn't really win the award, but just being a finalist was enough for me. But the price was horrible, and that was losing my daughter. Erin was 23 years old. She was healthy. She was going to graduate school. She went in for a simple hemorrhoidectomy. Now, who ever heard of someone dying from a hemorrhoidectomy? She went in on a Tuesday, or excuse me, went in on it was on a Friday, and she died the following Tuesday. And I didn't know anything about sepsis, didn't recognize it. I was just stunned. And seemingly the doctors treating her didn't know anything about it either, because 5 doctors missed the diagnosis. There was a 3-long medical malpractice trial, and court records showed that she had an infection early on, and the test indicated it, but the doctors didn't give her antibiotics because they were concerned it would cause diarrhea. I could have written the prescription myself if I had known what sepsis was. And amazingly enough, there are still hospitals that don't have the appropriate protocols. But I could tell you in 2002 when this happened, literally there was nothing going on in sepsis. I mean, I knew nothing about it. I was a dentist. Probably a few dentists today know much about sepsis. But there was little going on. There was 2001, there was some talk about some early goal directed treatment. And but the CDC, I called the CDC. Actually, I went there. And they weren't doing anything. I went to NIH, went to the halls of Congress, the governor of Florida. I knocked on doors all over. I heard about a fellow in New York called Kevin Tracy, wrote a book called Fatal Sequence about sepsis. And I went to see him. He said, why are you here? I said, I just want to meet some physician who knows something about dentists or about sepsis. And he said, well, I can tell you a lot about it. He told me about people in Europe. He said, Europe is ahead of the United States in sepsis. So I started flying over to Europe to meet the big experts over there. And I met a person by the name of Dr. Conrad Reinhardt, and he had an effect on my life. But I also went around and met people in Canada, and that led to the formation, and we're proud of this. The Sepsis Alliance is one of the founding members of the Global Sepsis Alliance. And Dr. Reinhardt is the one who set this up. So the Sepsis Alliance was not only the first advocacy group in the United States, but we were one of the founding members of the Global Sepsis Alliance, which has over 70 countries in it. Involved. We were the first Sepsis Alliance. And if you get on the Global Sepsis Alliance site, if flattery is the duplication, if you will, the mark of flattery, then this is it. Because when you look at the organizations that belong in Global Sepsis Alliance now, there's the Japanese Sepsis Alliance, Mongolia. There's over 100 organizations that are in this, so we were international. So we're very proud of that. Now, we are a small organization, but we're of a high caliber and high talent. Besides our core staff, the 2 people that are on this call today, our president and vice president, who joined us in 2007, really changed the direction of this organization, and it took off then. We also have a board of directors and a board of advisors, which total almost 40 people who volunteer their time and treasure to give back to the organization. You can see them on our website, and it's pretty impressive to meet these people. Unfortunately, they're not on today. As I mentioned, I had never heard of sepsis, and someone asked, what has changed since then? And I think that the movement itself, when it started in 2007 and Tom took over, it really is what set us on fire. I did want to mention that we also have on our board I mentioned the right people. We have one of the first members, that was Dr. Manny Rivers, who set up the guidelines for Sepsis Alliance. So we're very proud of our organization, and I want to have one of our speakers, and that's Steve Simpson, speak about the burden of sepsis, and that's what we're fighting here today. Steve, you want to take it over, please?
Yes, sir. Thank you, Carl. My name's Steve Simpson. I am a professor of medicine and pulmonary and critical care at the University of Kansas. I've been involved in sepsis research and quality improvement work for my entire career, which spans a long time. I was an intern 40 years ago this year. And I first got interested in sepsis 40 years ago this year when I encountered a patient who wondered if they had sepsis. Sepsis, I want to take just a moment because some of you are on here because you know sepsis, and that's a good thing. Some of you are on here because you're curious. So you may want to know what is sepsis and what are we talking about. The official definition that doctors use of sepsis these days is that sepsis is life-threatening organ dysfunction caused by a dysregulated host response to infection. What that means is that you get an infection, the infection is bad enough, your body responds overwhelmingly enough that you have organs that begin to shut down. A lot of people have likened this to the bumblebee you see here, or maybe it's a honeybee, I'm not sure. It's a bee. A bee sting hurts when you get it, but it's not particularly bad unless you happen to have that anaphylactic response. Infections can be this way. They can be very mild unless you have that overwhelming response. So how much sepsis is there in the United States? 1.7 million cases every year in the United States. And this was in 2014, and we know that the trajectory was on its way up at that time. In that year, 350,000 people died, and we know that trajectory was also on the way up. It's one of the reasons that I'm involved with this organization, is because it's one of the few organizations that's really aggressively trying to do something about the number of people that die. If you go into a hospital, actually that's on the next slide, I'll stick to this slide and just say that with COVID-19, you all know a lot of people died. You essentially with COVID-19 died from 2 or 3 things, and sepsis was one of the most common. Respiratory failure directly from the COVID. Sometimes people died from strokes related to the COVID. Lots and lots of people died from sepsis. It's either caused by the SARS-CoV-2 virus or that's secondary to being in the hospital with an immune system that's gone awry. Sepsis is a medical emergency, and we need to think of it that way. The more time that goes by between the onset of your symptoms and the time that you get treatment, the more likely you are to die. And so we need to pay careful attention. Our providers need to pay careful attention to that. The people that are at risk for sepsis are actually all of us, but the people at highest risk are babies that are under a year old, people who are on chronic immune suppressing drugs like prednisone and other things, chemotherapies, people who are older, and unfortunately that means people my age and up, people over 65. And then we know that people that are medically underserved are at higher risk from developing sepsis when they get an infection, and that means people of lower income neighborhoods, people that are in rural communities, and I've done a lot of work in my state in rural communities, and people that are of racial and ethnic minorities. But anyone can get sepsis. And if you want to see that, you can go on the sepsis.org, our website, and you can see that there are a lot of folks who were minding their own business and living normal lives before they got sepsis. And some of our board members are like that. By the way, I think I failed to mention that I am the chairman of the board of directors of Sepsis Alliance, which is why I'm here talking to you. Next slide, please. There we go. So the burden of sepsis in the United States. Some of this is research that I was involved in producing. Not the top line, though. Sepsis is the #1 cause of death in hospitals. It's responsible for anywhere between 35 and 45% of all the deaths that happen in a hospital. And it doesn't matter which thing it was that took you into the hospital. Yeah, a lot of people are admitted to the hospital with sepsis at the time of admission. A lot of other people develop infections and sepsis in the hospital. And if I go in for a routine surgery, one that doctors do day in and day out, something like a hemorrhoidectomy, like Carl told us, the thing that's most likely to kill me about all of that is sepsis. Sepsis costs more than any other condition that's treated in the United States. The estimated total cost is $62 billion a year. Now, I was involved in this research, and out of that $62 billion, $43 billion was literally what Medicare paid in 2019 for the care of septic patients. We had access to the entire database, and we can tell you, that's not an estimate. 43 billion in Medicare dollars, and the other bit is a bit of an estimate of people who aren't on Medicare and what that contributes. Sepsis is the #1 reason for hospital readmissions, and it is that in two different ways. If you come in with sepsis and are discharged, it causes a high number of readmissions. And in the second way, if you get out of the hospital with any given condition, sepsis is the thing most likely in the next 30 days to bring you back to the hospital. It's the #1 cause of hospital readmissions. A lot of people wind up losing their hands, feet, arms, legs because of sepsis. Leads to 14,000 amputations every year. Almost 60% of sepsis survivors. So out of that 1.7 million, about 1.3, 1.35, 1.4 million people are going to have worse cognitive function, mental functioning, physical functioning after their episode of sepsis. And within 3 years, if you're over 65 and you get sepsis, your risk of dying is about 60% in the 3 years after your episode of sepsis. Maternal sepsis is the second leading cause of maternal death in the United States. And every day, kids who are healthy, 200 kids are diagnosed with severe sepsis every day, 75,000 kids, and 18 kids will die from sepsis every day. Kids that were minding their own business till they got a cut or a scrape or a strep infection or you name it, they die from sepsis. And this is really sad and telling in the United States of America, that Black and other individuals that identify as non-white have nearly twice the incidence and nearly twice the mortality of sepsis as white people. That's a huge, huge burden. That's why all of us on this call are involved with Sepsis Alliance, trying to do something about it. And I hope if this is your first exposure to Sepsis Alliance, I hope you'll consider joining us in that fight. Next up is Tom Heyman. He's the CEO of Sepsis Alliance since, well, he knows for sure when he started, but he's going to talk some more about what we're doing at Sepsis Alliance about the problem.
Thanks, Steve. Very sobering report about this huge burden of disease, and which is sepsis. And I've been involved with the organization since 2007 when I met Carl, and just couldn't believe that what he was saying was true, that it was this widespread and this common, and I had never heard of it before. So I got on board and haven't looked back since. We have a huge opportunity to save lives and reduce suffering with this organization and our many partners. So why are so many of us being harmed by sepsis? You know, it was a very sobering report you just heard from Steve. This thing is common, deadly, expensive. It's got everything. And, you know, why is this happening? And, as an organization, we had to consider what problems are we trying to solve? What is our response to this? And, Carl talked about it in the video. Job number one was making sure that the nation knew what sepsis was. And at that point in time, very few people did. Only 19% of the country had even heard the word before. And, Microsoft did not have the word in its lexicon, in its dictionary. So if you type sepsis into a Word document, you'd get a spell check error. So the problems we're trying to solve fall into four pillars, and we're going to talk more about each of our work in each of these. But, the first is public awareness, education, and support for survivors and their loved ones. And we really want to make sure that our public knows as much about sepsis as they know about stroke. And in fact, sepsis is more common and more deadly than stroke. But we really need the public to know this is a medical emergency. They need to know the symptoms. They need to know to seek medical attention urgently if those symptoms appear. So that's job number one. Job number two is making sure that when that patient and family member advocate shows up at a healthcare location, that the providers there have a system in place, are educated and trained in sepsis. So job number two is to make sure that all of our healthcare providers across the continuum of care know as much about sepsis as they know about stroke, that it's on their radar, that every healthcare setting understands how common sepsis is, how quickly it can progress, and that they are ready to take it on. Job number three is making sure that our government is responding to sepsis in the way that it should, given its huge burden of disease, burden of cost, healthcare resources, and to make sure that our legislators, both on the federal and state level, are doing as much for sepsis as they are for other diseases. And so our work is very focused in that area as well. We'll talk more about that in a few minutes. And then innovation. Why is it that we don't have point of care diagnostics at every healthcare location? Why is it so hard to know if we have a bacterial or a viral infection to guide our antibiotic or antiviral treatment? Why is it these things don't exist? So our work is very, very focused on making sure that our innovation community has the pathways, has the support they need to bring more innovation from brain to bedside. And we'll talk more about that and our work in that area in a few minutes. And now I'd like to hand it over for a little more detail on pillars 1 and 2 to Abby Paris, who's our Senior Director of Programs. Abby.
Thanks, Tom. So as Tom mentioned, my name is Abby Paris. I'm the Senior Director of Programs at Sepsis Alliance, and I oversee both Pillar 1 and Pillar 2 programs. So the first of our strategic pillars is public awareness, education, and support. And this pillar works to provide the tools and resources to increase sepsis knowledge in the general population, as well as to provide support resources for sepsis patients, survivors, caregivers, and loved ones. If you could go to the next slide, please. Due in part to the hard work of Sepsis Alliance and Pillar 1 projects and efforts, public awareness of sepsis has increased from 19% to 2003 to 63% this year in 2023. Some highlights for Pillar 1 include sepsis.org and all of the content therein, which sees over 2 million visitors annually. Sepsis.org is home to all of our educational content, including videos, sepsis information guides, and our sepsis and library, which is one of the most visited sections of our website that covers many sepsis related topics, such as specific infections, different settings, and more. In 2023, we created several new resources, including multi-language resources. So some of our resources are translated directly to other languages, and the rest of our website is able to be translated via a website accessibility tool. We've also created resources for individuals with intellectual disabilities, resources related to home infusion, and resources related to influenza and sepsis, among many others. Another initiative on Pillar 1 is Faces of Sepsis, which invites those impacted by sepsis to share their experiences in a short written format. And to date, we've had over 1,800 experiences shared and counting. A big highlight for me on Pillar 1 is Sepsis Alliance Connect, which is a peer support community for those impacted by sepsis. And we'll talk more about that in the next slide. Perfect. As I mentioned, Sepsis Alliance Connect is a virtual support community designed for the millions of people affected by sepsis annually, including sepsis survivors, caregivers, and those who've lost a loved one to sepsis. Sepsis Alliance Connect launched in 2022, and since the launch just over a year ago, we've had over 1,200 registrants. Sepsis Alliance Connect hosts about 12 virtual support sessions per month, in addition to about one educational module per month. Some of the topics discussed in the educational modules include mental health after sepsis, exercise after sepsis, advocacy, and more. The program continues to grow, and we're really excited about our plans for 2024 as we plan to at least double our registrants, expand our program offerings, and diversify our support offerings to offer both live virtual support sessions and discussion-based programming to be able to support and reach more individuals. The power of Sepsis Alliance Connect really is the community and the connection it creates, as evidenced by the testimonials we receive from our participants. One recently shared that the connection with other survivors in the peer support group meetings is the most meaningful to them. It makes them feel safe and not alone. It makes me feel like I have a shot at a longer life than I had imagined after surviving septic shock. Sepsis Alliance Connect is sponsored by Biomere U, LB Charitable Foundation, and Merck. Perfect. The second of our strategic pillars is our professional education and training pillar. Pillar 2 works to provide healthcare professionals with a forum to obtain timely, high-quality continuing education, ask questions of their peers, share experiences, tools, and resources, and stay up to date on best practice infection and sepsis prevention, recognition, diagnosis, and compassionate care for patients, saving lives and limbs. You go to the next slide, please. Pillar 2 is responsible for Sepsis Alliance Institute, a learning management platform and healthcare professional community, which is home to over 150 free clinical education courses offering continuing nursing education. Sepsis Alliance Institute has strong connections with over 275 leading subject matter experts in sepsis and related conditions. This year, Sepsis Alliance Institute migrated to a new and improved platform. It was launched in May 2023, and this has enabled really strong peer-to-peer discussion and a new and improved resource library, which has led to increased collaboration and engagement with other healthcare professionals, in addition to the many live and enduring courses that are accessible through Sepsis Alliance Institute. Sepsis Alliance Institute has over 40,000 registered learners to date, consisting of nurses, advanced practice providers, EMTs, and physicians, amongst others, mostly working in critical care, emergency departments, and quality. Sepsis Alliance Institute is really highly regarded amongst our participants, and this is something we're super proud of. We recently received the following feedback. I've greatly appreciated the variety of educational content that is available for free. This has helped me so much to navigate my role as a sepsis coordinator. If you could go to the next slide. Looking forward to 2024, we'll continue to grow upon the several live events that are hosted in Sepsis Alliance Institute, including some of our events which are highlighted here. The Sepsis Alliance Antimicrobial Resistance Conference will take place in April, which is a 2-day conference that typically sees about 2,500 healthcare professionals across the continuum of care, really dives into antimicrobial resistance concepts and the relationship between AMR and sepsis. In 2024, Sepsis Alliance Institute will host 3 half-day symposia that will cover healthcare-associated infections, maternal and neonatal sepsis, and sepsis in immunocompromised and oncology patients. Our largest event of the year is Sepsis Alliance Summit, which takes place in September during Sepsis Awareness Month. That's an annual virtual 2-day conference where we see our most high attendance at over 5,000 healthcare professionals, again, across the continuum of care. Sepsis Alliance Institute will also continue to host CE webinars as live courses and then following with enduring courses, and sponsor innovation webinars monthly as both new research and new innovation comes to the forefront. All of these events are hosted virtually and registration is completely free. You can find them on sepsisinstitute.org. Sepsis Alliance Institute looks forward to a year of growth in 2024, continuing to expand our resource types, expand into new educational topics, and excitedly, we are seeking ACCME accreditation, so we'll be able to offer both continuing medical education for physicians and continue to offer continuing nursing education for our nurses. And that's all from me. And I'll turn it back to Tom.
Thanks, Abby. Very proud of what we've been able to accomplish in our first pillars 1 and 2. So pillar 3, policy and advocacy. This is where we engage change makers in government to provide the legislative and regulatory support for public policy that will improve sepsis awareness and care. Next slide. So we're relatively new in this area, but I have some really, very, very exciting wins to report. The SEP1 measure, which is, requires hospitals to follow a certain process for treating patients upon diagnosis of sepsis. And we know that those hospitals that do well with the SEP1 process have lower mortality rates. So it's a very, very important measure. And up until now, this has been a process measure that requires only reporting. So hospitals simply have to report how they do on the measure. So there's transparency, but there's no financial imperative or incentive or penalty attached to it. So Sepsis Alliance was very involved in the reauthorization of SEP1 for another 3-year term this year. That was a hard-fought win for the organization and sepsis patients. And then the further good news is that CMS has determined that it's important to add this measure into their hospital value-based purchasing program, VBP, which will now require hospitals not only to report on the measure, but depending on how well they do on the measure, they'll receive a sliding scale of reimbursement. So not surprisingly, we're getting a lot of attention from hospitals on how they can do better on the SEP1 measure, which is going to result in better sepsis care for patients. So we're really, really excited and very happy about that achievement this year. Next slide. Another big win this year is we worked very closely with the CDC on developing a hospital sepsis program on core elements. They have a core elements program for antimicrobial stewardship. And I think, we, among others, helped drive the CDC to determine that it was really important to give hospitals kind of a laundry list of things that they can and should be doing to improve sepsis care in their facilities. So another tool that is going to really push hospitals to provide better care, more attention to sepsis. And excitedly, this was endorsed by the American Hospital Association. So we're imagining we're going to see very, very good participation from hospitals, which will lead to improvements in care. Next slide. During Sepsis Awareness Month, we've been doing this for a couple of years now. We look for state governors and legislatures to declare September as Sepsis Awareness Month in their state. And this year, we're very, very excited. We had 39 states participate, and that was due to the hard work of advocates across the country who reached out to their governors and governors' offices to get their states to participate, which led to an increase in awareness in the state, and in many cases, additional media attention to the fact that the state was doing Sepsis Awareness Month and drawing attention to the importance of sepsis awareness. Next slide. So first of the 2 really big initiatives we have in the works, the first is Lulu's Law, which is legislation that would call on the CDC to create pilots to develop a national sepsis data trust. So really inspired by the cancer registries, National Program of Cancer Registries, which was formed in the 1990s. And was a game changer for our understanding of cancer and the fact that it was not one thing, but more than 450 things. So we really believe that this is important for sepsis as well, to understand the heterogeneity of the pathway from infection to sepsis, and kind of collating the data in the way that the cancer registry did would allow us to really better understand sepsis, why some people get it, other people don't. We really don't have a great understanding of this. So we are pushing for this legislation to move forward. And Lulu is actually named after the daughter of one of our board members, Lucas Haynes, his 4-year-old daughter, Lulu, from my neighboring town of Montclair, New Jersey. Lulu passed away during an appendicitis episode. She became septic and ended up dying of septic shock. So we are committed to this program, and we'll continue to push forward to get sponsorship, joint sponsorship in both the House and the Senate to move this forward. Next slide. Perhaps the biggest initiative we just recently during the month of September called on the Biden-Harris administration to create a national sepsis action plan.
This is something that the G7 and World Health Organization have encouraged all countries around the globe to have a national sepsis action plan. The US does not have a national action plan at this point, and considering the significant burden on this country, it really has to change. So we put out a call for the government to create an action plan, and we will continue to pursue that in the year ahead. Moving on to Pillar 4, we know that innovation across different sectors, including not limited to diagnostic devices, health technologies, and pharmaceuticals, will lead to improved outcomes. So we are at the forefront of convening survivors and loved ones, clinicians, industry leaders, government, and other stakeholders to collaborate and innovate. Next slide. So the way this is manifesting is that about two and a half years ago, the FDA invited us into a meeting and asked us if, as Sepsis Alliance, as a patient advocacy organization, would serve as the convening organization to bring together stakeholders from across sepsis, whether it's clinicians, researchers, industry, government agencies, and of course, patients, with a common mission to determine how can we work together trans-competitively in the common interest of improving sepsis care, and how can we work together to make sure that we can facilitate the flow of innovation from brain to bedside? How can we make sure that we have diagnostic tools in place at every hospital, but not every hospital only, every urgent care, every primary care, every home, so that we can really catch infections that are progressing to sepsis that much earlier? There we go. So where we are now is we have over 100 individuals and organizations participating in the Sepsis Innovation Collaborative, which is what it's called, working very, very closely with our funding partner, ASPR and BARDA, and now the FDA has formally engaged as a partner to the Sepsis Innovation Collaborative. We're very, very excited about this. And we have a couple of workflows happening. One is better understanding of the experience and unmet needs of patients and survivors. We've interviewed over 1,500 patients to generate a deep inventory of experience that can inform the needs for innovation. We are also working on a project to de-risk, we're calling it, the regulatory and payment pathways for novel devices. In other words, making it easier for innovations to move through the regulatory pathway and then find a reimbursement scenario so that we can make sure these are available to every patient. And then we'll also be taking on additional issues related to data and also improvements in clinical trials. We know from many of our industry partners that one of the things that holds them back, some of it's funding, but also is access to clinical trial participants, clinical trial sites, clinical trial diversity, and that's something we hope to be helpful in that realm as well. Next slide, and I think I hand it over to Samantha.
Yes, thank you. Sepsis Alliance launched several observances to help highlight and honor those impacted by sepsis. We declared September as Sepsis Awareness Month in 2011, and every year since have seen an increase in participation by the public, healthcare professionals, and partner organizations. So thank you to all of you who have participated. In 2019, we launched Sepsis Survivor Week, Pediatric Sepsis Week, and Maternal Sepsis Week to raise awareness of the impact of sepsis on those who survive and the unique experiences and challenges faced by pediatric and maternal sepsis patients. And as part of Sepsis Awareness Month, we have our annual virtual event, the Sepsis Superhero Challenge. This event, launched in 2017, encourages all of our advocates to raise sepsis awareness in their community. We've had supporters host stand-up paddleboard events, yoga, volleyball events. We've even had multiple Twitch streamers host Sepsis Superhero Challenge fundraisers. We hope you'll consider getting involved next September and look forward to hearing about all of your creative fundraising ideas. Tom, back to you.
So, we've, Steve often mentions that the American Cancer Society has been around for over 100 years. So we've been at this about 15, 16 years. We're still in the early innings. We know we've made a lot of progress and we're very, very proud of that, but we know there also is much, much work to be done. We're probably in the bottom of the second inning at most, probably the bottom of the first. So looking ahead, we're really excited. We're just finishing up a process on creating a 3-year strategic plan. So we're trying to look forward a little bit farther down the road in terms of how we can have, even more impact than we've had thus far. So, when you think about it, how do we make the entire country sepsis knowledgeable? How do we make every person in this country know enough about sepsis so they can seek care more quickly and take care of a loved one? How do we make sure that every healthcare professional in this country knows about sepsis, whether it's through medical school, dental school, nursing school, et cetera, on-the-job training? How do we make sure our first responders can identify sepsis in the field? We're not there yet, and we really need to get there. How do we make sure the government is doing as much for sepsis as they do for other diseases, given the disproportionate burden of disease that sepsis represents? And how would we make sure that innovation is available so that in our homes we can have a test, an affordable test that will tell us if we have a bacterial infection or a viral infection, which will save us a trip to the hospital and a lot of expense? These are all things that are achievable, and together we can make those happen. Back to you.
Okay, so how do we fund all of these programs and this important work? Sepsis Alliance relies on donations and sponsorships from individuals, companies, foundations, and the government to continue our work. So thank you again for making an impact with your donations to Sepsis Alliance. You can see on this slide, I wanted to just show just 10 years ago, when Sepsis Alliance was a small organization with one strategic pillar, our annual revenue was just under $200,000. We have grown in tremendous ways and are proud of the way that we have expanded our support and programming, thanks to growing our annual revenue to over $2 million this year. You can also see that our funding is made up primarily from corporate sponsorships, grants, and contracts, and we look to continue growing our partnerships in those areas while also diversifying our funding by increasing the number of individuals who support Sepsis Alliance. The average nonprofit in the US gets about 60% of their income from individual donors. So if you think about if each person who visited sepsis.org could give just $1 a year, that would be an additional $2 million a year for our programs. So in addition to all of the ways that you already support Sepsis Alliance, we appreciate your consideration if you are able to support charities you care about this year. Thank you again for your time today. We wanted to share a few ways that you can get involved. And as a reminder, as I go through this list, please add any of your questions into the Q&A box so that we can get to those. So some ways to get involved: follow us on social media. We've got LinkedIn, Twitter, Facebook, Instagram, and YouTube. You can sign up for our email newsletter at sepsis.org. A lot of you are probably already on it, which is how you found out about this meeting. Participate in advocacy initiatives at sepsisvoices.org. Attend peer support sessions at sepsisconnect.org. You can take free courses and engage with your healthcare professional peers at sepsisinstitute.org. And of course, you can support Sepsis Alliance with a gift. We're in giving season, so you can go to sepsis.org and click donate at the top. And you also can give gifts of stock. You can give through your IRA, and now this year with Venmo. So we have our Venmo code there. You can contact me. Again, my name is Savannah at sstark@sepsis.org if you have any questions about ways to give. And I think before we get to Q&A, Carl wanted to make an announcement, I believe. Carl, are you ready? Carl, you're on mute, if you could unmute.
I'm sorry. I do have an announcement. I've been a big supporter of Sepsis Alliance for the past 20 years, which means I'm getting a little bit older. As a matter of fact, I turned 80 in a few months. And I've had a lot of mentors. I've been very fortunate in my life, unfortunately about Aaron. But overall, I've had an incredible life. And I've had mentors that really influenced the way I thought, and things have worked out pretty well. And he said one thing to me. He said a number of things, but the thing that really stuck with me, it says, we have a ethical responsibility to be financially successful. That is, whatever your business, you need to do well at it. You need to make a lot of money so you can take care of your family and yourself. And you practice a better service because you don't have to do those procedures. He also said, once you have enough, you have a moral obligation to be financially significant. That is, once you have enough for yourself and your loved ones through their life expectancies, you have a moral obligation to support those churches, nonprofits, things like that. So I got to think that because, you know, here I am, turned 80 years old, hard to believe. But when you see what sepsis has accomplished in the past 20 years, I mean, there was no sepsis organizations. And now, as I mentioned, we've kind of changed the way infections are treated. We need to do more, and we have to have the money to do that. So I'm going to help do that because, Aaron, when my kids were young, I made each of them bought a policy, $1 million policy, endowment policy for each of them, because in that day and age, or this day and age, really, with divorce and things like that, you never know what's going to happen. So it was an economic safety net for each one of my children. Aaron, of course, now is not going to be able to receive hers, so I'm going to give that to the Sepsis Alliance. I can't think of a better place to give to people, you know, and an organization that's done so much but needs to do more, because I was just looking at, we were talking about cancer. They are $100 million organization. It's a little disappointing that we're only at 2.5 million, but really for what we're doing, and as Tom always says, we punch above our weight. It's incredible what Tom and Savannah are doing. But to do more, we need to have more money. So I'm donating that $1 million to the organization in appreciation for what they've done for me and my family, and so we can help others. So that's my announcement. Merry Christmas.
Thank you so much, Carl. And, you know, through Carl's gift, we will be launching a planned giving society. So for anyone interested in learning more about planned gifts, again, please reach out to me. Okay, I think we are ready for questions. There's quite a few in the Q&A box. First off, we're getting a few questions regarding SEP1 and the upcoming CMS changes. Tom or Steve, can you speak to that?
I'll let Steve take that.
Okay, I'll do that. So SEP1, many of you understand that CMS put this regulation out in 2015, which required that hospitals track how well they diagnose sepsis, how well they do significant components of sepsis care, and that they report how well they were doing. And so in order to get your full Medicare payments, you had to be reporting. Now, CMS has stepped that up. Not only do you have to report, you will have to meet certain standards of quality of care and perform those simple sepsis care measures. By the way, I'll list what those are. They are blood cultures before antibiotics. They are antibiotics in less than 3 hours from sepsis recognition. They are measurement of a lactate and a repeat measure of lactate if it's high the first time. They are administration of IV fluids to people who are hypotensive, and for people who are hypotensive, that a doctor comes back and documents that they've reassessed the patient within 6 hours. Simple things, common sense things. As of next year, these will be required. You'll have to meet certain standards. We don't know what the standards are yet, whether they'll be, you've got to be 90% compliant, 80% compliant. You've got to be in the top 5 or bottom 5 or above the bottom 10%. We don't know that yet, but that's what is happening. So there are questions about SEP1, and I'll go ahead and answer this question as well that I saw in the Q&A about SEP1. People ask, are they going to adopt the Hour 1 sepsis bundle? Surviving Sepsis campaign has suggested that rather than antibiotics in 3 hours, we ought to be doing it in 1 hour, that we ought to be getting the blood cultures, the antibiotics, and the measured lactate within 1 hour. I don't think CMS will adopt those unless and until there is proof that those work better than what we have now. I will tell you there's an ongoing NIH-sponsored trial called the AIMS trial that is looking at whether 1 hour bundle is better than 3 hour bundle, a randomized controlled trial. That's ongoing right now, and we know no information about it. So stay tuned and we'll let you know when we do.
Thank you, Steve. Next question, why is there lower survival in non-white patients?
Tom, should I take that, or you want to speak?
Yeah, go ahead, Dr. Simpson.
Okay. Well, so this is a multifactorial question, and it's a very good question. Not only is there lower survival, there is delayed diagnosis among non-white patients. So what are the root causes of that? They are multitude. One is that if you step back and look at it, we're only 3.5 generations removed from African American people being in slavery. We are few generations removed from Native American people being shoved out and moved off of their land. And we continue, Caucasian Americans have always had, as a group, not every individual, and maybe not you and maybe not me, but have had systematic or systemic biases against Hispanic folks. It's just simple fact. Such things happen in the 50s, 60s, and 70s as redlining to keep people who are non-white living in conditions that were substandard. And the ripple effects of all of that has continued. So what are some of the things that have resulted from that? One is that people that are non-white in actual studies have demonstrated that they don't trust the medical profession. Why might they not trust the medical profession? Have you ever heard of the Tuskegee experiments? The ripple effects from that continue to this day. In fact, in actual work done by the American College of Chest Physicians, it was determined that the level of trust that non-white people place in the medical profession is on the level of what they place in law enforcement, and we all know what the problems are there. Right or wrong, that's not what I'm saying. There are problems there. So all of this manifests. So when people who are non-white come to the emergency room with sepsis, who are they going to see in the emergency room? Okay, 20% of Americans are Hispanic, less than 6% of doctors are Hispanic. 13% of Americans are African American, less than 6% of doctors are American. 2.9% of Americans are Native American, less than 0.4% of doctors are this. So who are you going to see when you come to an emergency room? It's far more likely you're going to see a Caucasian individual administering care. Now, does that mean Caucasian individuals have bad intent? No, but do Caucasian individuals pick up on the nonverbal clues from non-white or non-white ethnicity, Hispanic ethnicity people, as well as someone their own color or ethnicity would? No, clearly we do not. The diagnosis among people who are non-white is delayed for a number of reasons. People have a higher incidence if they live in low socioeconomic conditions, and I think some of the things I've told you have forced many African American, Hispanic, Native American people into low socioeconomic conditions where the access to medical care is poor. So often they show up not to their doctor with early symptoms, but to the emergency room with late symptoms, and that portends worse outcome in sepsis. So that was very long-winded, I do understand, but this is a hugely important issue that we have to get fixed. I guess that's enough. Next question.
Great. Another one, I think for you, you mentioned there is a high chance of readmission. Is this because sepsis is not being diagnosed correctly in the hospital, leading to a return, or is it due to sepsis recurring after treatment?
It is due to both of these things. If you have been discharged from the hospital with a sepsis diagnosis, you are within the next 30 days, 30% of those people will be back to the hospital with a different episode of sepsis. Now, does that mean that the first episode of sepsis caused that? We do not know. In a very large study that we did of Medicare patients, we see that people come back, but the data are not there to tell us a couple of different things. One is your first episode of sepsis because your body has reached an age where you just don't handle infections well, and therefore you're not going to handle the next one very well too? Or does sepsis itself alter your immunity because of how it impacts you the first time, so that your immune system is still out of whack for years to come? We don't know the answer to that. Yeah, so sepsis results in repeat episodes of an additional sepsis, a different infected organ. And here's an answer that we don't know. We do not know for certain because we don't have the research to establish this. We believe that the readmissions can be altered by early detection of sepsis and stopping it in its tracks before it's highly severe. But we don't know that for a fact. So I won't say that. There are many of us who do believe it.
All right, we've got time for one or two more. This one for Abby. How can I share my sepsis experience?
Yeah, the best way to directly share your sepsis experience is by submitting a story to Faces of Sepsis, and I will share the link if it hasn't been shared already. And certainly also joining Sepsis Alliance Connect provides another way to connect with others and share your story.
Great, thank you. And Tom, I think you might want to answer this one. What percentage of funds go to programs?
Yeah, that's a really important question when you're thinking about supporting a not-for-profit. We're at about 75% of our funds go to programs, which is, very, very high for a not-for-profit. And we always strive to really be as efficient as possible with our funds. And that's led us to receive, extremely high ratings from GuideStar and from Charity Navigator.
Thank you. Let's see, just to kind of close up, thank you again so much for your time today. In a moment, as we close the webinar, you'll see a survey pop up on your screen, and we would certainly appreciate your feedback. Please feel free to reach out to us with any questions, and we hope to see you at other Sepsis Alliance events. Thank you and have a great rest of your day.